الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Occupational noise, one of the occupational physical hazards, by Professor Mahmoud Hani Sulaiman. These are the physical hazards. Again, I put this slide just to remind you about them. Sound. Back and forth vibration of a sound source travel in air at speed of 343 milli per second. Simple variations called pure tones, characterized by physical, acoustic dimensions of frequency, amplitude, and starting phase. Frequency equal number of vibrations occur in 1 second and has units of hertz or kilohertz. Time it takes to complete one cycle of vibration has units of seconds or milliseconds. Frequency range for human hearing from 20 to 20,000 hertz. These are the different sound waves. Upper left, you see the amplitude. Lower, you see the frequency, either high frequency, higher pitch, or lower frequency, lower pitch. Upper to the left is the quieter, when the amplitude is small. On the right is the louder sound when the amplitude is wider. These are the sound waves, which are noise. Ways to characterize noise, as we said before: frequency, intensity, nature, and duration. Frequency perceived as pitch, intensity perceived as loudness, nature steady state versus impulse or impact, duration length of time exposed. What is noise? Noise is unwanted sound. It is a sound which is unwanted sound. Noise level in environment: normal conversation about 55 decibel, car running at 50 kilometers about 60 to 80 decibel, HGV running at 50 kilometers. HGV means heavy goods vehicle, 80 to 95 decibel. Motorcycle 75 to 100 decibel. Train at 200 kilometers about 100 decibel. Discotheque, disco 85 to 100 decibel. Jet, when it takes off, about 110 to 115 decibel. Military low-level flights 105 to 120 decibel. Socially, people talk at 2 to 4 millimeters distance, so noise should not exceed 60 decibel. Outdoor recreation people talk at 5 to 10 meter distance, so noise should not exceed 55 decibel. At work, people converse at 1 meter with difficulty, with noise at 78 decibel. For prolonged conversations, noise level must be lower than 78 decibel at work. Sound levels. Human ear hear sound frequency 20 to 20,000 Hz. Daily maximum tolerable sound level to human ear 85 decibel. Auditory fatigue appears in 90 decibel region, greatest at 4000 Hz. Sound level above which tympanic membrane rupture 150 to 160 decibels. Noise sources are road traffic, air traffic, rail traffic, industry, recreational activities, construction sites, traffic on waterways. Classification of noise according to duration: continuous, interrupted, or impulse. So continuous noise, like in spinning and weaving industry. Interrupted noise, like air compressors and airport and traffic noise. Impulse and impact noise, like explosions, firearm, and hammers. Classification of noise according to frequency: high frequency noise, low frequency noise, and white noise. High frequency noise are sounds of saws. Low frequency noise, sound of grinders. White noise, mixed all frequencies, either high or low frequencies, sound of boilers. Noise intensity is measured by an instrument called sound level meter. The unit of measurement is decibel, given by this symbol. Frequency is measured by cycle per second, as we said before. This slide shows noise level and its source. So the lowest is rustling leaves، ورق الشجر بيخبط في بعضه. Then vacuum cleaner about 30 decibel. Then quiet office just 60 decibel. Then lawn mower just 70 decibel. Then diesel truck, snowmobile. Then motorcycle at 85 decibel, risk of injury and gradual hearing loss at 85 decibel and higher. Motorcycle more than 90 decibel. Chainsaw more than 100. MP3 player at maximum, just below 110. Chainsaw 110. Jackhammer more, just below 120. Stereo at maximum 120. Rock concert about 125. Jet airplane 130. Threshold of pain is more than 130. Above 130 is the threshold of pain to the ear. Just to remind you about the anatomy of the ear, please observe these are the ossicles, semicircular canals, cochlea, tympanic membrane, and eighth nerve. This to remind you about how sound transmitted to inner ear, then to brain via auditory nerve. So it comes from sound from headphones, outer ear, eardrum, to the cochlea, and signal to the brain via auditory nerve. These are hearing disorders caused by environmental and industrial agents used in history taking and differential diagnosis. This list is helpful in history taking and differential diagnosis. When you find a worker in an industry or in noisy place, there are other causes that can cause hearing loss. Yes, on top of list, noise-induced hearing loss, but there are other disorders and causes of this. noise-induced hearing loss, noise-induced tinnitus, acoustic trauma, ototoxicity due to chemicals, including medications, organic solvents, heavy metals, carbon monoxide, non-steroidal anti-inflammatory, ASA, cisplatin, aminoglycoside, furosemide. Remember, these medicines can cause ototoxicity. Damage to auditory cortex, ear disorders due to diving, noise, barotrauma, air embolism, radiation-induced damage, trauma to external and middle ear. Effects of noise, auditory effects and extra auditory effects. Auditory effects detailed explanation will be given later, but now these are the non-auditory: acoustic trauma, sudden hearing damage, tinnitus, ringing in the air, TTS, temporal threshold shift, PTS, permanent threshold shift, interference with communication. Non-auditory effects of noise also: insomnia, irritability, fatigue, headaches and nervousness, decreased communication, decreased concentration and increased rate of mistakes, irritability of fetus inside pregnant women, hypertension and sense of fear. Other: noise and sleep, increased time taken to fall asleep, causes awakenings and changes in sleep stages, decrease REM, which is rapid eye movement sleep, sleep disturbance in turn lead to poor performance, noise sensitive individuals and elderly are more vulnerable, chronic exposure lead to increase of cortisol. In Europe, about 1/4 have severe difficulties falling asleep or staying asleep. Chronic sleep disorders also caused by noise. Drivers falling asleep lead to 20% of accidents on German roads. Noise and performance, distracting effects of noise impair performance, as we said, especially in children and in noise-sensitive and anxious people. Learning skills impaired, memory recall decrease in children. Noise and hormones, it will lead to immune dysfunctions, which increase vulnerability to disease and infections. Environmental stress from noise lead to production of stress-related hormones. Noise and fatigue, increased fatigue and irritability after work in noisy environments. When noise is scientifically defined to be a hazard. Duration, it is a hazard if it is of longer duration, of increased intensity, and repeated exposure, and the worker is more susceptible. 85 decibel for steady state noise, 140 decibel for impulse impact noise sources. Auditory effects. Noise causes destruction of hair cells of organ of corti in inner ear. This insidious and gradual progressive loss of hearing. It begins at frequency of 4,000 to 6,000 Hz, then spreads to other lower and higher frequencies. This graph shows cross-section of the ear to show organ of corti, as you see in the triangle, and corti tunnels and basilar membrane. So damage to cilia on basilar membrane in organ of corti in inner ear on long exposure to noise cause sensorineural hearing loss among workers. Did you know noise-induced hearing loss is number one occupational disability? Number one occupational disability. 4 P's: painless, progressive, permanent, and preventable. Painless, progressive, permanent, and preventable. Principal hazard from noise is decreased hearing, either reversible alteration in hearing levels. It's called temporal threshold shift, which resolves if work changes to more quiet work. It lasts few minutes to months depending on noise level. If exposure is too high, noise sustained for long period, it will lead to permanent shift, which is noise-induced hearing loss. It is of type sensorineural. Impulse noise lead to rupturing or even disrupting oscillators. Loss is initially predominant in higher frequencies, 4 to 6 kHz, and classically depression at 4 kHz seen on audiometry. Continuing exposure will lead to hearing loss to higher and lower frequencies. Initially, there is difficulty in hearing in noisy environment and of sounds of women and children. Consonants have more frequency than vowels, so lost first. This will lead to degradation of discrimination of speech. Hearing loss is frequently associated with tinnitus, may be more disabling than deafness. Tympanic membrane seem normal, but testing with tuning fork shows sensorineural deafness, usually bilateral, but some activities as firearms lead to unilateral loss depending on site of noise source. A speech range which is 0.5 to 2 kHz, so the hearing of speech is not affected first. This graph shows on the left side portable audiometer, which is used in factories, and on your right side is the audiometric test booth. Worker sit inside the booth and the physician outside with the apparatus, with the audiometer. This graph shows example of an audiogram used to record pure tone threshold. An audiogram key as shown on right is usually included with an audiogram identify symbols. This is the key to identify symptoms on your right side. This is the audiogram filled with the results of a worker. On your left side is early, as you see, at 4,000 at 4 kHz depression, the so-called V depression, and the depression increase and go to other frequencies as the worker is exposed to noise. Common descriptive categories used for degree of hearing loss. There is normal for adults till 25 hearing loss. This is normal, 25. Mild, moderate, moderately severe, severe, and profound. Common audiometric definitions of types of hearing loss: sensorineural, conductive, and mixed. Sensorineural, conductive, and mixed. In sensorineural, abnormal AC, abnormal BC. ABG is less than 10 decibel. Conductive, abnormal AC, normal BC, and ABG more than 10 decibel. Mixed, abnormal AC, abnormal BC, ABG more than 10 decibel. Prevention of noise hazardous effects of noise. Prevention of hazardous effects of noise. Medical measures Pre-placement and periodic medical examination include history of exposure affecting hearing. We said before what other sources, what other causes that can induce hearing loss in a worker. And pure tone audiometry. Environmental measures, reduction of noise at source, isolation, segregation of noisy processes, and using of personal protective device. These the different PPDs used for as ear protectors. This is on your left upper helmet with muffs, reduce about 30 to 35 decibel. This under them is muffs, reduce about 25 decibel. These are earplugs, reduce about 10 to 15 decibels. These methods shown in detail. This for you to use when you are being in a noisy place or you are supervising workers in a noisy place. So type of hearing protector here, disposable foam earplugs, and the details. Here the type is pre-molded earplugs and the details. Here is banded earplugs, over the head ear muffs, helmet mounted ear muffs, and the detail. Here is how the worker put it in his ear, and here on the right is how the worker using the helmet with the muffs. Please read it and use it. Here how to put the earplug, squeeze, which is molded, roll, push, and fit. At least 75 of the plug should be inserted into the ear canal when using pre-molded or disposable earplugs to be effective. Please read and use. وفي النهاية الحمد لله رب العالمين, و thank you for your good listening.